Good evening, Professor. My name is Laretha Lewis, and welcome to Reducing and Eliminating Alcohol Intake Presentation. Without further ado, let's get started. Alcohol is a source of a number of health issues affecting the health of individuals. By strict consideration, alcohol is a drug. However, authorities have allowed the consumption of alcohol to certain levels. Excessive consumption of alcohol results in a condition called alcoholism. The sustained use of alcohol leads to intoxication. The effects of intoxication often leads to changes in the metabolism of the liver and brain. Intoxication is manifested in delayed reflexes, clumsiness, effects to the brain, and slurred speech. As a drug, alcohol works in a complex process which inhibits and accelerates several proteins and hormones in the body. For instance, the consumption of alcohol stimulates excessive production of insulin. Excessive insulin in the body leads to accelerated growth of glucose metabolism, which is a precursor to diabetes, low blood pressure, and irritability. How alcohol attacks the brain. So these are some examples of what alcohol does exactly to different sectors of the brain. Public health significance of alcoholism. According to the study commissioned by the World Health Organization, approximately 3.3 million of people die every year as a result of harmful effects of alcoholism. Alcohol consumption has a causal relationship with a range of behavioral and mental disorders. Some of these include alcohol dependence, cardiovascular diseases such as cancers, liver diseases, as well as road accidents and violence resulting in injuries. Furthermore, there is evidence that the harmful use of alcohol results in incidences of infectious diseases. These include pneumonia, HIV/AIDS, and tuberculosis. It also creates considerable social consequences and negative health on individuals who drink heavily. To put it into context, alcoholism is an established causal factor that results in 200 injuries and diseases. There was an observation by 2012, alcoholism had resulted in a global disease burden of 5.1%. That year, an estimated of 3.3 million individuals succumbed to the effects of alcoholism. Furthermore, alcoholism results in the economic and social losses. The morbidity and mortality per consumed liter of pure alcohol are significantly higher in lower economic wealth countries than in higher income countries. Risk factors of alcoholism. Alcoholism is a disorder whose exact cause is still a mystery. However, harmful consumption of alcohol is the biggest risk factor for alcoholism. Additionally, there are other certain factors that increase the risk of an individual developing alcoholism. Research has established that males who drink to the excess of 15 drinks of 1 liter each week run the risk of developing alcoholism. For females, it is 12 drinks or more per week. Additionally, taking 5 drinks per day of binge drinking, i.e. 1 day per week, may also result in alcoholism. Additional factors include living with a parent who has developed an alcohol disorder and mental health problems such as schizophrenia, anxiety, and depression. Other secondary factors include peer pressure, high-level stress, low self-esteem, family culture, or close relative or parent with an alcohol use disorder. Excessive consumption of alcohol results in 88,000 deaths annually in the United States. Additionally, alcoholism is responsible for 1 out of 10 deaths from the demographics of working adults. It is therefore results in age threatening by an average of 30 years for those who die as a result of alcoholism. There are chronic conditions such as high blood pressure, stroke, liver disease, heart disease, and various cancer, which develop over time as a result of excessive drinking. Individuals also exposed to sexual risk behaviors which result in HIV infections, unattended pregnancy, and sexual transmitted diseases. Exposure to alcoholism leads to violence and injuries. Other similar effects are falls, sexual assault, homicide, suicide, drowning, and intimate partner violence, amongst others. For expectant mothers, alcoholism may harm a developing fetus physically and behaviorally. These effects may hamper normal learning of the child after birth. The theory of planned behavior. There is correlation between alcoholism and the theory of planned behavior. This theory has two variables: alcohol consumption and the intention of consuming alcohol. These two variables have different effects on individuals depending on their gender, age, and pattern of alcohol consumption. There is a strong correlation between the pattern of consumption and the demographic that an individual belongs to. Generally, it has been observed that men are more likely to consume alcohol. Females, on the other hand, will have a strong attitude with the intention to consume alcohol in a relation to men. Furthermore, adults are more likely to exhibit stronger intentions to consume alcohol than adolescents. Constructs of planned behavior model. The theory of planned behavior has 6 constructs. First, there is a behavior intention. It states that the stronger the intention it will to engage in a particular behavior, the more likely a person will engage in that behavior. Therefore, individuals with a strong affinity towards alcohol consumption are more likely to partake in alcoholism. Attitudes indicate the degree to which an individual perceives favorable or unfavorable certain behavior. For instance, the individual that has an unfavorable evaluation of alcohol consumption is unlikely to be affected by alcoholism. To the contrary, those that favor alcohol consumption are at risk of alcoholism. Subjective norms refer to an individual's belief that a person or a community approves or disapproves of certain behavior. If an individual belief is that alcohol consumption is approved in the community, then they are more likely to partake in alcoholism. Those that do not believe that their community approves alcohol consumption are more likely to not engage in alcohol consumption. Subjective norms are closely associated with social norms, which refer to the customary codes of normal behavior associated with a group of people within a cultural context. If society generally uses alcohol, then it is more likely than that individual will also use alcohol. To the contrary, if society in general does not use alcohol, then the individual will be less likely to partake in drinking. Under the construct of perceived power, it is believed that the presence of various factors may either impede or facilitate a certain behavior. For instance, if the prices of alcohol products are relatively cheaper, then the perceived power of an individual to resist the consumption of alcohol is low as opposed when the prices are higher. Perceived power also informs perceived behavior control. It is a perception of difficulty or ease in which an individual finds in performing a certain behavior. If an individual, for instance, lives next to a bar, they are more likely to engage in alcohol use than an individual who lives far. Alcoholism behavior modification. The most effective modifier of the behavior of alcoholism is treatment and rehabilitation. The nature of an alcoholic drink is that it is an intoxicant. Therefore, the feel-good factor makes it most impossible for individuals to leave or modify the behavior of alcoholism on their own account. Under medical supervision, individuals will find professional help with withdrawal symptoms such as rehabilitation in a comfortable, safe, and realistic environment. Furthermore, People who are affected by alcoholism need a paradigm shift in the mental and attitudinal state of mind. For instance, they are expected to overcome the very risk factors that were getting them closer to alcoholism. Placement, and this relates to the behavior modification. So as a counselor, we typically use DSM-5 for diagnosis and ASAM for placement. And based on the recognition, the treatment, medical education, mentorship, management, and finances, and policy of communication of a facility is how we dictate what and where an individual is placed. And placement, of course, is based on ASAM criteria again, and we specifically discuss acute intoxication and withdrawal potentials, biomedical and complications, emotional behavior and cognitive conditions and the complications, readiness to change, relapse, continued use, continued problem potentials, and recovery using environment. Being a military substance abuse counselor, there are actually 7 criteria that we utilize for military placement and dependent as well. And the 7th is actually operational commitments. And that's just based on whether a person is able to participate in continuing care after they finished with their treatment. So just a little FYI, treatment is established in 4 levels. Level 1, which is outpatient. Level 2 is intensive outpatient. Level 3 is residential. And level 4 is detox, and that's being hospitalized. So based on these ASAM criteria is how we decipher what patient goes where. And these are our references. I'm going to shift my box so that you may get the full visual of my references. And the top is the WHO reference. Shift it over, and there you go. Thank you so much for your participation and your patience. I hope you've learned something. I hope it was enjoyable and it meets all academic requirements. Thank you again, and have a good night.